Knock knock.
Come in.
Hello, how are you?
I'm good.
My name is Felix. I'm a student nurse. Currently, I'm practicing as a nurse practitioner with the United States University. And today we're going to do an abdominal examination. And I would like to confirm one more time, what's your name?
My name is XY.
XY. And your date of birth, please?
7792.
7/7/1992. So, being a student nurse, whatever we're going to do today, I could like to have your cooperation, please. And one more thing, we're going to record it. I'm going to upload it to YouTube, send it to my professor for grading. Is that something that you're going to allow me to do, please?
Yes, it's okay.
Thank you. Consent has been given. And earlier on, the patient, she's a female. She was accompanied by the mother. The mother is currently seated by the door, and she's okay with whatever we're going to do today. Is that not the case?
It is.
Thank you once again. So under abdominal inspection, we're ruling out gastrointestinal pathologies.
Okay.
And this really helps us to identify any pathologies that are are already in place for prompt treatment, okay?
Okay.
So the first techniques we're gonna use on abdominal examination is inspection. The second one is gonna be auscultation. The third one is gonna be percussion, and the last one is gonna be palpation, okay? So before we proceed to our examination, I would like you to empty the bladder first.
I just did it.
Oh, you just did it? So the purpose is just to promote comfortability, okay? And what do you think about the room temperature? Because I'm going to expose part of your body, and I don't want you to feel like cold or it should be too hot.
It's just fine.
All right. So paying attention to the lighting of the room, it's well lit. The temperatures have been put into consideration. My patient has emptied the bladder. So I'm going to have my patient to lie on spine position. I would like you to lay on your back, please.
Okay.
I'm going to support her head with a pillow and her 2 feet with a pillow too. And this is to promote abdominal relaxation. Then we're going to drape our patient, exposing only areas of examination, and this is to promote privacy for our patient. How are we doing so far?
Good.
Okay, thank you. I'm going to expose this a little bit. Up there. I'll have her hands alongside her body, and these two promote abdominal relaxation. So under inspection, what are we looking for? We're looking for the shape of the abdomen, the size of the abdomen, any skin discoloration, any hernias, ascites, and striae, which is the breakdown of the reticular dermis part of the skin. Okay? So I'm going to stand on the right side of the patient and have a close look on the abdomen. Right now, I'm checking out the contour of the abdomen. Our patient's abdomen is well-shaped. It's not distended. When you check both the left, the right, and the left front areas, the gastric area, the umbilical area, the symphysis area, there's no protrusion or any bulging of an organ. We cannot striae on the abdomen. Usually striae is related to obesity, ascites, any gastrointestinal carcinoma, and pregnancy. For our case over here, my patient is a para 1+0 previous pregnancy, So this trial is related to previous pregnancy, and that's not something to worry about, okay? There's no discoloration, there's no bluing of the abdomen. And when we talk about discoloration and bluing of the abdomen, number one, we're ruling out the coolant sign. The coolant sign is the bluing of the umbilical, the navel area, which indicates pancreatitis, okay? And when we have a close look on your right flank and the left flank, still there's no bluing, and this is, we're ruling out hemorrhagic pancreatitis. So my patient's abdominal color is normal to ethnicity. So far, no abdominal findings, no abnormal abdominal findings we're able to note, because the abdomen is well shaped, well rounded, non-distended. Okay. All right. So the second part we're gonna go is auscultation, and here we're going to listen for the abdominal sounds. In listening for abdominal sounds, we do have normal sounds, bulging or gargling sounds. Number two, we have abdominal sounds which are abnormal, which is gonna be high-pitched or ringing sounds, and these they indicate obstruction, or ileus, which means absence of sound, and this is a disruption in motility of the normal abdominal dysfunction. And this, I'm going to use my stethoscope in listening for the sounds. I'm gonna use my diaphragm. So I'm gonna wrap it to keep it warm, because a cold stethoscope can be ticklish, and it wraps some abdominal muscle contractions, leading to false sounds. So in listening for the abdominal sounds, we start from the right lower quadrant up to the right upper quadrant, go clockwise to the left upper quadrant, come down to the left lower quadrant. And under the 4 quadrants, we usually listen for 15 to 30 seconds for any sounds. And if we don't hear anything before we say there is absence of sound, it should be concluded at least if we've listened for over 5 minutes. And usually the normal bowel sounds, it's 2 sounds at least between 2 to 5 seconds, okay? And usually the normal sounds is between 5 to 30 sounds in a minute, okay? All right. Wow, you got some good sounds over there.
Oh, wow.
So the normal sounds, what I'm able to hear is the gargling sound, and that is the expected sound, which is a normal finding, okay? So the second one, we're going to listen for the brutes. And when we're listening for the brutes, we're gonna listen for the aortic, mama, and the renal artery murmurs. Then we're gonna listen also for the liver and the spleen, okay? So when we listening for the brutes, we use the bell of the stethoscope. And I'm going to listen for the aortic murmur. And the aortic murmur is is approximated 2 centimeters above the navel area. There's no abdominal sound head, so we're ruling out aortic aneurysm. I'm gonna listen to both flank areas. I'm gonna start with the left flank area. I'm ruling out the left renal arteriostenosis. There's no brute on the right side, so I'm ruling out the right renal arteriostenosis. And I'm gonna have my patient taking a deep breath, and we're gonna listen on the right marginal area for any hepatic rap sound. Taking a deep breath for me. There's no rap of the river. On the left marginal area, this region right here, we're gonna listen for the spring rap. One more time for me. There's no rap, and we're ruling out spleen rap, so meaning there's no splenomegaly or any abnormality. Okay. So the third phase we're going to do is percussion. And under percussion, we're listening for the normal sounds, which is tympanic, and normal sound that is found in the air-filled abdominal spaces in the abdomen. And we're trying to rule out any dullness, which is indicative of an enlarged organ or fluid. Okay, so here under percussion, we're gonna percuss for the liver, we're going to percuss for the spleen, and we're going to percuss for the kidneys. Okay, so under percussion, I use my non-dominant fingers. I'm gonna place it over the right lower quadrant, and I'm gonna use my 3 fingers of the dominant sign, and we're going to percuss the abdomen right now. The normal expected sound is the tympanic sound, I am not sure whether you're able to hear it, but if you're used to doing this, you're really able to differentiate it really easily. Over here, it changes to a dull sound, and I'm gonna mark this area, and this area is the this area is the inferior margin of the liver. Could you please put your hand down for me? Thank you. So we're gonna continue the areas of dullness until it changes from dullness to regular resonance. So I'm gonna mark this area over here. So it's all tympanic sound. I'm gonna take my measuring tape, the areas that we marked over here, and it's 6 centimeters. So it means the liver is within the normal range of 5 and 7 centimeters. So we're getting 6 centimeters and we're ruling out hepatomegaly, okay?
Okay.
So I'm gonna percuss for the spleen. And when we percuss for the spleen is we're gonna concentrate on the left margin area over here, okay? And I'm gonna ask you to take in a deep breath for me. One more time for me. There's no change in dullness. All we're able to hear is a tympanic sound, meaning we're ruling out splenomegaly, okay? So the next thing we're going to do, we're checking for the shifting of the fluid in the abdomen to rule out the ascites, okay? And this I'm gonna percuss from the right flank to the left flank. I allow my patient to turn over and we're gonna wait for at least 20 to 30 minutes to have the fluid shifting to the right side, and we're gonna try to look out for any shifting dullness. In the absence of any shifting dullness, we're ruling out ascites. Any question for me? All right, thank you. All the way is tympanic sound, so I'm gonna have my patient to roll over for me. And we're gonna wait for at least 20 to 30 minutes to have any fluid shifts, if any. How are you feeling so far?
I'm okay.
All right, thank you. So we're gonna start percussing again. Checking out if we're gonna find any shifting dullness. There is absent dullness, so meaning that there's no ascites, so we're ruling out any fluids in the abdomen, okay? So I'm gonna have you to sit up for me and we're going to percuss for the kidneys. And I'm gonna go to the left costovertebral area. I'm gonna place my palm. Tell me what you feel, okay? Did you feel anything?
No.
The patient is supposed to feel just the pressure of my fist, but no reports of pain. So my patient verbalized no pain or anything. So we're ruling out any pathologies on the kidney. Then I come to the right costovertebral area. I'm gonna place my palm. Did you feel anything? No pain. So we're ruling out any kidney pathologies on percussion. So the fourth phase in our abdominal examination, we're going to palpate. And under palpation, we're going to check for any enlargement of the organs. Ma'am, is there as far as we've come, is there any part of the abdomen that you feel any pain?
No.
So the importance of asking the patient is that those painful areas, they should usually come last in palpation. And myself, as I'm going to palpate the patient, I'm gonna be looking on the patient's face to see any changes in grimacing, which is an indication of pain or discomfort. So the first thing we do is right palpation, and we start from the right lower quadrant up to the right upper quadrant to the epigastric area, to the left upper quadrant, down to the left lower quadrant across the symphysis. The main reason for light palpation is to check out for any masses and any sensitivity on the abdomen, which we've ruled out. So right now we're gonna go for deep palpation, and we should be feeling for the organs. On the right costal margin, some of the normal finding we expect is the fine margin of the liver is an expected thing. Right there. That's your liver right there. We're gonna continue to the left margin. Take a deep breath for me. No pain is felt. So we're ruling out splenomegaly. Is your bladder still empty? So we're gonna palpate for the symphysis pupils to feel for the bladder. It's not felt for. And on the inferior iliac fossa right here, we're gonna try to feel for the gallbladder to rule out cholecystitis. Could you take in a deep breath for me? Any pain?
No.
So the patient is able to feel my palpation on inspiration, the Murphy sign, to rule out cholecystitis. So we're gonna use bimanual. Further, we're gonna advance to bimanual palpation to check out for the kidneys, okay? So I'm gonna use my dominant hand to go into the left costal vertebral area, support it up, and try to feel for the kidneys. Any pain?
No.
I'm not able to feel for anything, which is a normal finding. I'm gonna come to the right costal vertebra, support it up. Try to feel for the right kidney. I'm not able to feel for anything, which is a normal finding. So right now we've done with palpation, but we're gonna rule out appendicitis. And one of the signs that we're gonna use to rule out appendicitis is using the Rovi sign, whereby I'm gonna ask the patient to tell me if she's gonna feel pain on the right side if I induce a part on the left side. So tell me if you're gonna feel any pain on the right side, okay?
Okay.
Once I tap the right, once I tap the left side, okay?
No.
Let's try one more time. So the Rofi sign is negative. Patient was not able to feel pain on the right side. So we're ruling out appendicitis. The second sign we're gonna use is the obturator sign. So I'll have you lift your right foot and go over the left thigh, okay? Any pain on the abdomen?
No.
So the obturator sign is negative. We're ruling out appendicitis too. So we're gonna have the patient to the OR sign, and under the OR sign, my patient is gonna lie on the left side and she's gonna extend the foot. No, lie over. Any pain?
No.
All right, we're ruling out appendicitis when we're using the OR sign. And now lastly, we're gonna do the head test and the leg test. In the head test, we're looking for the supra-umbilical muscles, and the leg test, we're gonna look for the infra-umbilical muscles, if there is any protrusion, if there is any hernias. Could you please lift your head up a little bit? So we're gonna feel for the abdominal muscles. They're all well aligned. There's no protrusion. So we're ruling out any hernias. Thank you. Could you lift up your legs for me, please? So under this, we're listening for the infra-umbilical muscles. They're all well aligned. There's no protrusion. Thank you. I'm gonna stand on the leg side of the patient and ask the patient to cough. And this is gonna help me to check out if there is any hernia or any protrusions. Could you go ahead and cough harder for me, please? One more time for me. No hernia, no protrusion was noted. And at this point, I'm gonna thank you for your cooperation. Everything has been successful, and you are a very nice patient to me. And I thank you for that. Thank you so much. And this comes to our end of our abdominal examination. So the next thing, I wash my hands. I'm gonna clear my table and we're gonna do the documentation. Thank you.